everybody to the Board of Health meeting. Just a couple of quick reminders. Anyone participating on Zoom, please keep your microphones on mute unless called upon to speak. Those participating by phone, please keep the phone on mute at all times unless called upon to speak, and do not put the phone on hold. And please avoid using speakerphone when speaking. Please speak directly into your device's microphone or your telephone receiver. I'm now going to ask the Deanne to conduct the roll call, please.
Member Banham?
Present.
Member Cloutier?
Présent.
Member El Shantari?
Present.
Member Gower?
Here.
Member Kavanaugh?
Here.
Member Lakin? Nope. Member Menard?
Present.
Member Pinel?
Present, ici.
Member Tilley?
Present.
Vice Chair Di Giovanni? And Chair Aglai.
Present.
You have quorum, Mr. Chair.
Thank you very much. Regrets. Member Lakin has sent his regrets. I'll now go over the procedure for the meeting. So attendance, should members need to leave the meeting, they should advise verbally that they're doing so before clicking on leave meeting from the Zoom platform or ending their call if participating by phone. In terms of the process for speaking order, I'll provide each member with the opportunity to ask questions or comments. Members will be called on to speak in the order or reverse order as set out in the board secretary's voting list. The usual five-minute limit will apply. Should you not wish to speak on a given matter, you may decline verbally when your name is called. For voting purposes, if a full recorded vote is not taken for a given item, I will specifically ask if the item is carried, and then call for dissents to ensure that all votes are properly registered. In terms of points of order, privilege or challenge, procedural interjection should be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order where you have not been called upon to speak, please state your name aloud for the record before stating your point of order. Should technical difficulties or other unforeseen matters require a recess during the course of the meeting, unless the board secretary issues new instructions, members are requested to remain on the line. The board secretary will mute all participants in such an instance. I will now call for declarations of interest, and I have one. So I will read it out as per the board secretary's direction. I, Chair Keith Eglai, declare a potential deemed pecuniary interest in the Ottawa Board of Health Agenda 20, Item 3, 2022, Draft Operating Budget for the Ottawa Board of Health, Document 1, page 5, Ministry of Health Programs and Standards, 100% city programs, as I'm on the board of directors of the Youth Services Bureau, an organization that will receive funding from or would be eligible to receive funding from this budget line item. Are there any other declarations of interest? Okay, seeing none.
Chair, not a point of a declaration of interest. Am I the only one that's getting feedback from the chair, or are others?
You're the only one, I think.
I'm not sure what to say. Are you getting bad feedback, Member Cloutier? Maybe if you logged off and logged back on, maybe might help. I'm asking for confirmation of minutes of the meeting on November the 1st, 2021. Can we confirm the meeting's minutes, please?
Yeah.
Okay, thank you very much. We have 5 communication items that have been received. Can we receive them as noted in the agenda, please?
Receive.
Thank you. I'm going to call on Member Menard. Member Menard is going to move our procedural motions tonight. Thank you for that. And I'll ask you to introduce the motion to introduce reports.
Thank you very much, Chair. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer Health verbal report, and the report titled 2022 draft operating budget for the Ottawa Board of Health be received and considered.
Can we carry that?
Carried.
Thank you. I'm going to go through the agenda now. So the first item will be my report. So we'll hold that. That will be followed by Dr. Etch's report, which we will also hold. Then we have third item is the 2022 draft operating budget for the Board of Health, where we'll have a PowerPoint, and we have a delegation signed up as well. So we will hold that. And that is the meeting. But having said that, that is a lot as we're dealing with the budget. I will provide my verbal report now. So good evening, everyone. Bonsoir. Kwe, Inye, and Tanshe. To begin my verbal update tonight on a very positive note, I'm happy to report that on November the 15th, we received written confirmation that the Ontario Minister of Health has approved the appointment of Dr. Michelle Foote as Associate Medical Officer of Health with the Ottawa Public Health. Dr. Foote commenced work with OPH in December of 2020. Since then, she has been a tremendous asset to the health unit. So with this formal approval of the province, I would like to officially congratulate Dr. Foote on her appointment and welcome her to the OPH team. Early this month, Ottawa Public Health's Mental Health and Substance Use Health Unit offered training to members of council and their staff titled Mental Health Crisis Support and Self-Care Practices. 2 virtual sessions were held on Tuesday, November the 16th and Friday, November the 19th. The objective was to increase mental health literacy, foster resilience, prevent crisis, and increase knowledge of available mental health and substance use health supports. These 1-hour sessions were led by public health nurses Linda Cove and Norma Monterosa, with the support from Chanel Brown. A total of 33 counselors and counselor staff attended. Following the sessions, participants were invited to complete an evaluation survey, and I'm happy to report the feedback has been very positive, with participants stating increased knowledge and understanding of the mental health resources and supports. As part of this training, OPH has offered all participants in the opportunity to take the Living Works Start Suicide Prevention Training. This is a 90-minute online course that teaches participants to recognize when someone is thinking about suicide and connect them to help and support. I'd like to personally thank Linda, Norma, and Chanel, as well as Kim Sear, who helped to coordinate these important sessions. Still on the subject of mental health and substance use health training, last week the Canadian Centre on Substance Use and Addiction, CCSA, hosted its biennial Issue of Substance conference. The event is Canada's only national conference that brings together addiction workers, healthcare professionals, researchers, policymakers, knowledge brokers, and people with direct or indirect lived or living experience with substance use or substance use disorders from across the country. Anticipating the event would garner media attention, the CCSA, the Community Addictions Peer Support Association, and OPH worked together to coordinate and deliver stigma and first-person language training to media partners in advance of the iOS conference. CCSA and CAPSA developed a stigma primer for journalist manual, and using this primer with support from OPH, on November 22nd, they delivered a workshop to media partners on stigma and person-first language. We know that how the media reports on or talks about mental health and substance use health can have an impact on stigma and influence how the general public perceives these topics as health issues deserving of our respect and compassion. Therefore, I want to thank our partners at CCSA and CAPSA and to the OPH staff for your forethought in preparing and delivering this training in advance of the iOS conference. Thanks to our media partners for taking the time to be part of this important training. On November the 19th, members Banham, Kluche, El Shantiri, and I participated in the Association of Local Public Health Agencies, or ALPHA's Fall Symposium. The morning began with a public health video showcase before the call to order and greetings from the ALPHA president. There were welcome welcoming remarks by the Honorable Christine Elliott, Ontario Minister of Health, Alan Odette, CEO of the Ontario Medical Association, Dr. Steiny Brown, Dean of the Dalla Lana School of Public Health and co-chair of Ontario's Science Table. Then came an update from Dr. Kieran Moore, Ontario's Chief Medical Officer of Health, followed by discussions on post-pandemic recovery and beyond. The afternoon featured separate sections, one for the members of the Board of Health and one for the Council of Medical Officers of Health. It was an informative and productive day, and I would encourage all board members to participate in future Alpha meetings and events if they're able to coordinate it with their schedules and other commitments. And I know that can be a challenge sometimes. Member Cloutier indicated that he wished to briefly share his perspective on the day, so I'll just turn the mic over to Member Cloutier.
Thank you very much, Chair Egli. Merci beaucoup. Comme le président a dit, c'était une journée avec beaucoup d'informations et très productive. Et moi aussi, j'encourage tous les membres du conseil de santé de la ville d'Ottawa de participer aux réunions d'Alpha s'ils peuvent. The meetings and the conferences are a great opportunity for a whole number of reasons. And it is nice to hear from the Minister of Health and the Chief Medical Officer of Health, and they play key roles in how our public health is governed and funded and managed. The meetings also provide a valuable opportunity to meet with our peers and other boards of health from across the province to discuss topical issues that affect us all. Like the chair mentioned, the morning including discussions on post-pandemic recovery and beyond, specifically a panel discussion with 4 representatives from Public Health Ontario titled After the Storm, Public Health Considerations for Recovery and Beyond, where panelists talked about shifting priorities and opportunities as we start to move beyond the pandemic. And it was followed by a discussion with Dr. Christopher Simpson of the Ontario Public Health titled Recovery to Transformation, Lessons from the Pandemic. And he talked about lessons learned from the pandemic and how the system recovery can serve as a catalyst to improve healthcare in Ontario. And there was a discussion with Dr. Kwame McKenzie of the Wellesley Institute titled New Normal, New Foundations, where he noted that the recovery offers new challenges, but also an opportunity to collectively build on the innovations and the lessons learned from the pandemic. And the Minister of Education, Stephen Lecce, spoke and offered continued support on the safe and open schools. And so what we get from this morning's session, you saw a theme there, dear colleagues, dear members, that since early 2020, our public health units have demonstrated resilience and commitment as they responded to a global health crisis like nothing ever experienced. And so working side by side with governments and partners, Ottawa Public Health, we have faced pressure from COVID to provide that critical information and support to our community. And so sustaining that response, but recovering and moving on and returning to somewhat to the new normal with the services that Ottawa Public Health provides is the challenge that we're now facing. During the afternoon, the Board of Health section meeting, we continued with Dr. Moore and received an update from AMO's Director of Policy, the Association of Municipalities of Ontario Director of Policy, and learned from the Legal Counsel of Alpha about public health in the workplace and vaccination policies for employers, and the mixture of public health law and health and safety legislation, privacy legislation, and constitutional issues. We've all received letters about our role in advocating for vaccines and how that fits into the constitutional issues and the Charter of Rights. So the highlight for me in that was the kind of the shaky rule of law for employers, but also the essential foundation for ensuring the accountability of government and private enterprise, private actors in our community, just laws that protect fundamental rights, open government, and accessible justice. So, Chair, thank you very much for giving me the opportunity to share my thoughts on the Alpha and the highlights that for me. Thank you. Merci.
Thank you. I don't know, Member Banham or Member El Chancheri, have any thoughts you'd like to share about the program that they saw? I'd give you an opportunity to do that as well. Member Banham?
Thank you. So yes, as always, it was very valuable to attend the Alpha conference, and there were many interesting presentations that I will not recap as you have both done so. But I thought it was very interesting because my previous attendance at an Alpha conference was in November of 2019. So about 3 months before we started to hear of the spread of the COVID-19 pandemic. And at that Alpha conference, there was a presentation which detailed the possibility of a pandemic happening and how it would spread. And it's just very interesting that 3 months later, we actually saw that presentation come to light. It was actually entitled Death, Disease, and Destruction. I still remember that that title, and then we kind of saw what happened with COVID. But what was very interesting to me is at that conference was the time where it was being examined to move from 35 public health units to 10 public health units. And we were looking at what that transformation would look like at that conference. And so to see what has now happened over the pandemic, and just to see what we see every day and what we know that the staff see every day, that when you have local public health units who are able to respond to local issues and local surges, it is so important. And so that I felt that the comparison between that previous November 2019 Alpha conference and this Alpha conference that was talking about the importance and the positive role that all of our public health units have played throughout this pandemic. It was so important, and I think it was so refreshing, even though we are still in the midst of this global pandemic. It was refreshing to see that everyone understood the fundamental role of public health. So that was a very interesting comparison that I'd like to share. It was very clear to me that the focus is on stability, so creating stable responses that are easily rolled out, stable funding that people can rely on. That was very clear. And then the last piece that was really important, that really stuck out to me, was the discussion about health equity, and that COVID doesn't discriminate, but it does affect different populations differently. There was a great comparison given by the presenter regarding how we need to be able to increase access to supports to communities that require it most before these things happen. And so I know that once we kind of catch our breath a bit, I think a lot of that health equity work to plan for the next thing will be very important. And I was really happy to hear that highlighted at this Alpha conference. So again, thank you to everybody who supported me to attend. I find it very valuable, and I'm just so thankful to be part of it. Thank you.
Thank you very much, Member Banham. Member El Shantiri, do you have some thoughts on the conference?
I think my two colleagues did a great job covering most of the good one, but one of the areas stood out, and I reached out to Monica Turner out after, since we worked together at AMO and Roma, and obviously there's a role for all of us to play, and even now it's been established the need and the understanding for the public health. Now, how we can keep that momentum, and I think it was clearly from the ministers who attend, they value the work that public health has been doing and has done in the last couple of years. But the one that stuck in my mind actually was when the chief medical officer through Q&A answered, this pandemic is going to stay with us for a long time. We need to learn to live with that. And I thought, wow, that, we were hoping, with the vaccine, it's going to, but clearly he touched on something we saw this week with the new variants come from the African continent. So we're not over yet, and it's not going to go anytime soon. So that really stuck in my mind more than anything. And I apologize if I keep the camera off, because I keep getting signals say you have low bandwidth. So that's why I keep my camera off. Thank you.
And I remember at the beginning of all this, when we were talking about we're going to stay home for 2 weeks, and boy, has that changed. So thank you very much, everyone, for your contributions and your attendance. This past Thursday, I had the privilege of touring the COVID-19 community clinic at the Eva James Memorial Center in Canada, along with Dr. Etches, Mayor Watson, and councillors Kathy Curry and Alan Hubbley. Mary-Claude Turcotte, OPH's manager of immunization, provided the tour, and local media were also invited to attend. It was a wonderful opportunity to see firsthand how OPH's vaccine clinics have been modified to make them child and family friendly. Among other things, Jerry the giraffe, and a big kudo to the OPH staff inside that costume. They did a wonderful job. There was a rumor going around that it was Councillor Menard based on the height of Jerry, but we soon found out that it was OPH staff that was helping out. So you're more than welcome, Councillor Menard, should you want to help out in some way. So Jerry was there to help the kids get vaccinated, meet them there. There were colorful stickers and superhero selfie posters, a lot of innovation going in to make it as comfortable as possible for our kids to get vaccinated, which is Dr. Etches will speak to in a little bit, is absolutely a priority for us right now to get the kids vaccinated as quickly as we can. So it was a very friendly, welcoming environment that OPH has put together for the children. We also got a chance to meet and chat with the nurses and OPH staff and have an opportunity to thank them for all the work that they've done, not only at this clinic, but in all the preceding clinics. So it was nice to have that face-to-face and the opportunity to thank them on behalf of the board. And I want to thank the parents. I want to thank the parents who are signing up their children in record amounts. Again, Dr. Etches will speak to a little bit of that during her verbal update, but we've had great uptake amongst families and kids to get vaccinated. And, everybody is jumping right into it and working towards getting this done as quickly as we can. On Thursday, November the 18th, Dr. Etches was awarded the Saphir Female Personality Award from the Franco-Ontarian Foundation. This award recognizes and values the commitment, excellence, and influence of women in the Franco-Ontarian community. And on Friday, November 19th, the Ottawa Board of Trade announced Dr. Etches and the OPH team as recipients of the Best of Ottawa Business Awards 2021 Newsmaker of the Year. Congratulations to Dr. Etches and the entire OPH team on these well-deserved awards and recognitions. Additionally, this month, our previous MOH, Dr. Zalifi, was inducted into the Order of Ottawa. So again, a well-deserved recognition for the work that he did while he was our MOH and continues to do for Canadian Blood Services. Given that this is our last meeting of the year, I'd like to take this opportunity to talk a little bit about the upcoming holidays. I know many people have started planning for their Hanukkah, Christmas, Kwanzaa, New Year's Eve, and other celebrations over the coming month or so. So we are in a much different situation than we were this time last year, especially as we were starting to vaccinate younger children. I want to remind everyone, especially with the new variant arrived, to be vigilant this holiday season. When planning get-togethers and celebrations, consider everyone's vaccination status, assess the risk of those you're gathering with. If you choose to attend a larger gathering, maintain a physical distance and wear a mask when this might be difficult. Consider planning outdoor activities. I know it's cold and I know it's winter, but we're Canadian after all, so we're used to doing things outside in the cold. We're opening doors and windows to improve ventilation if you're gathering indoors. Information on safer gatherings can be found on the OPH website. I'll conclude by wishing everyone a happy Hanukkah, Merry Christmas, joyous Kwanzaa, and a Happy New Year. And I'd be happy to take any questions before Dr. Etches leads us through her report. Seeing no hands, can we receive the report, please?
Received.
Received.
Thank you. I'm now going to call on Dr. Etches to lead us through her verbal report.
Oh, good afternoon, Kwei, Tanshi, bonjour. It is relatively COVID centered tonight. I will provide an update on the COVID situation and then the COVID vaccination program. And so most of you board members know that yesterday the government of Ontario announced 2 individuals in Ottawa tested positive for the COVID-19 Omicron variant with recent travel from Nigeria. And we are now aware of 2 other returned travelers who have tested positive for the Omicron variant. Ottawa Public Health is conducting the case and contact management, and the individuals, all 4, are self-isolating. Hier, le gouvernement de l'Ontario a annoncé que 2 personnes à Ottawa ont testé positif pour le variant COVID-19 Omicron lors d'un récent voyage en provenance du Nigeria. Encore, il y a 2 autres identifiés aujourd'hui dans les voyageurs. Et Santé publique Ottawa gère les cas et les contacts, et les 4 personnes s'auto-isolent à présent. So we are working with the province to monitor COVID-19 variants of concern, which beyond Delta, which is the vast majority of what is in our community, now includes Omicron. And in order to rapidly identify, trace, and isolate COVID-19 and the variants, Ontario has expanded eligibility for PCR testing to people who've returned from or traveled in Nigeria and South Africa, Mozambique, Botswana, Zimbabwe, Lesotho, Eswatini, and Namibia. It's asymptomatic family members and other household contacts who are also eligible for testing when there's a traveler returning. And so to reduce the transmission of the Omicron variant, and out of an abundance of caution, we are advising travelers who've been in these locations within 14 days before arriving in Ottawa and members of their household to immediately self-isolate, even if fully vaccinated, and to follow the federal guidance and any additional guidance provided as Ottawa Public Health contacts people. We know that the federal government has reached out to returning travelers, and we have as well a list of 15 travelers that have returned from these areas in the last 14 days, and everyone's been following the federal guidance and speaking with us. And so the second thing is to seek testing for COVID-19 at one of Ottawa's assessment centers, whether or not people have symptoms. And the federal guidance at this time is to be tested immediately upon arrival and then 8 days after arrival, and to isolate from household members. So to stay in a separate room or to stay in our isolation center here in Ottawa that is free until you receive those negative test results. I would like to say, additionally, beyond focusing on these countries that have been listed in guidance, is that given the rapid and ongoing expansion of countries where Omicron has been detected to date, it includes jurisdictions on multiple continents, that a cautious approach could consider any recent travel outside of Canada, which is including but not limited to countries or regions with confirmed Omicron cases, as a potential increased risk for Omicron acquisition. So as international travel general is going to potentially open people up to other variants. So the federal government is examining border measures. The provincial government is overseeing testing and sequencing and surveillance and our health system capacity. And as Ottawa's local public health agency, we're focused on case and contact management and supporting all people in Ottawa to limit the opportunities for COVID transmission. Le gouvernement fédéral examine les mesures à prendre aux frontières. Le gouvernement provincial supervise les tests et les séquençages, la surveillance et la capacité de le système de santé. En tant qu'agence de santé publique locale d'Ottawa, nous nous concentrons sur la gestion des cas et des contacts et sur le soutien de tous les habitants à Ottawa afin de limiter les possibilités de transmission de la COVID-19. The best way to limit transmission of COVID-19 is to get vaccinated and to remain vigilant, practice the basic public health measures we have, including wearing a mask, maintaining physical distancing, and limiting our close contacts. Expanding access to vaccination is important across the world. And so in the coming days, we may see an increase in the number of people testing positive because of transmission of the Omicron variant in Ottawa. And this is not a new virus. The public health measures that we have will help reduce the spread of the Omicron variant. And anyone experiencing COVID-19 symptoms should get tested immediately, because the sooner you know something is a COVID, the sooner you can take steps to limit its transmission. So to talk about vaccination more, I think, again, it feels like old news, but it was just last week almost that on the 19th of November, Health Canada authorized a vaccine for children ages 5 to 11. The National Advisory Committee then issued its recommendations with respect to how it would be used. And the first doses of the pediatric COVID-19 vaccine arrived in Canada on Sunday, the 21st. On Tuesday, parents were been able to book vaccine appointments through the provincial booking system. We have well over 25,000 first dose appointments booked that first day in our clinics, the larger clinics, and we've began administering the vaccine on Friday, November 26th. So I'm pleased to report that as of last night, over 8,400 Ottawa children in this age group have received their first dose of the COVID-19 vaccine. Nous avons commencé à administrer le vaccin contre la COVID-19 aux enfants âgés de 5 à 11 ans le vendredi 26 novembre et je suis heureuse d'annoncer qu'en date d'hier soir, plus de 8 400 enfants d'Ottawa de ce groupe d'âge ont reçu leur première dose de vaccin contre la COVID-19. So at this point, it's over 40% of this age group that have either received their first dose or have an appointment on the provincial booking system. And as others are receiving vaccines in pharmacies and physicians' offices and many locations, I'll describe again, it's the Ottawa Public Health Vaccine Dashboard that will help us assess vaccine uptake over time. So that's now updated Monday, Wednesday, and Friday. Protecting the health of the population through COVID-19 vaccination continues to be an undertaking by many partners, for which I'm very thankful. So parents can review our website to assess which immunization option will work best for their children, including our 7 larger community clinics, perhaps one of the neighborhood vaccination hubs where you don't need a provincial booking system appointment. For those neighborhoods with more barriers, there are over 100 pharmacy locations, often taking walk-in appointments or walk-in, I guess they'll serve you on a drop-by basis. You might be dropping in. There are mobile teams and primary care options for some. And in addition, CHIO is offering vaccination for children with medically complex needs. And it's this week, December 2nd, that Ottawa Public Health begins our schedule, rotating through 73 vaccination clinics in schools after hours. This schedule for these clinics is now on our website. And further, First Nations, Inuit, and Métis community members can be vaccinated with the Wabano Centre for Aboriginal Health Team. They're hosting a clinic at the Richelieu Vanier Community Centre. And Inuit community members can go to the Akausivik Inuit Family Health Team for their shots. So we want to recognize there are some parents who may hesitate to just waiting a bit to see and vaccinate their children. We understand parents do have questions about the vaccine. So I encourage parents and guardians with questions to speak to their healthcare provider, their pharmacist, or to contact Ottawa Public Health to speak to a public health nurse to learn more about the vaccine and the importance of getting your children vaccinated. J'encourage les parents et les tuteurs qui ont des questions à s'adresser à leur fournisseur de soins de santé, à leur pharmacien local ou à Santé publique Ottawa pour parler à une infirmière en santé publique afin d'en savoir plus sur le vaccin et l'importance de faire vacciner leur enfant. I want to reiterate the rationale for immunizing children aged 5 to 11. While most children, thankfully, will not experience severe outcomes from COVID-19 infection, some will. We can't always predict which children, and vaccination decreases the risk of severe outcomes. Vaccinating 5 to 11-year-olds also helps them stay in school and benefit from the social and developmental supports that are provided by in-person learning. And lastly, when children are less likely to transmit COVID-19 because they're immunized, they are helped indirectly by the benefits that come from keeping COVID-19 manageable in the community. More access to activities, parents and guardians with more access to employment, and less concern that adults they care about and depend on will require hospitalization. So parents, please visit our website, ottawapublichealth.ca/COVID or child COVID vaccine for the most up-to-date information about how to protect your children with vaccine. We are also continuing to make progress on administering third doses to people who are eligible. We're interested in seeing the uptake of the third doses grow more quickly. So currently, anyone over 70, First Nations, Inuit, and Métis people, and healthcare workers who have passed 6 months since their second dose are eligible to have the booster, as well as people with certain types of immunosuppression. Now, I just say that again, we're hoping to see higher uptake of these third or booster doses in the community. It is important, the science is there to support people over 70 benefiting from that third dose, just bringing that level of protection against COVID back up. And while there is disparity in vaccination coverage between Ottawa neighborhoods with less socioeconomic advantage and neighborhoods with higher socioeconomic advantage, many of Ottawa's neighborhoods with the lower coverage rates have been catching up. This gap has been narrowing as we continue to see residents come out for their first and second doses. So thank you. And last week, we updated our neighborhood vaccination coverage estimates on the Ottawa Neighborhood Study website. You can have a look. These neighborhood estimates show that coverage with at least one dose for 12 years and older is now at least 75% and at least 71% for fully vaccinated coverage. Efforts to increase uptake and ensure that no child is left behind are continuing in the neighborhoods with lower uptake. We're working closely with partners in providing information in languages other than English or French. We're ensuring that the service providers who regularly work with families have up-to-date information about the vaccination. We're distributing appointment cards in neighborhoods to make it easier for families to access the vaccine at the school pop-ups. And we are offering mobile clinics in shelters and in other places where people have barriers. C'est important de continuer avec les mesures de réduire les barrières pour les personnes et les enfants qui ont difficulté avec le transport ou accès aux vaccinations dans les cliniques. Every vaccine approved for use in Canada is safe and effective, and vaccination is one of the most effective ways to reduce the spread and the impact of infectious diseases, whether it's seasonal flu or childhood infections like chickenpox or COVID-19. And again, the rationale for all of us is many people infected with COVID-19 do experience only mild illness, but others get severe illness and can die. And so there's no way to know how COVID-19 will affect you. It is the vaccination that helps protect you by creating an antibody response without having to go through feeling the sick and the illness of COVID-19 infection. Everybody who gets vaccinated takes us one step closer to greater community immunity. And this is true locally, provincially, nationally, and internationally. This is a global pandemic requiring vaccination around the globe in order to mitigate further transmission and variants. So I want to encourage everyone who is eligible to get vaccinated as soon as possible. And thank you again for those who are doing so. Especially want to thank the children, 8,400 Ottawa children who've come forward to be vaccinated. Congratulations. You are the heroes right now in our community, really making a difference. And parents, thank you for booking those appointments. Thank you for talking about your children to help them through and feel comfortable with the decision to get vaccinated. Chair Eglai mentioned the upcoming holiday season. I know variant is on the minds of some, but we're in a very different situation than we were this time last year. We do have significant protection from COVID through the vaccination program. We know about the measures that can control transmission. It is true, we have 2 doses required for completed series, now 3 doses for some is looking like what's recommended. So we're not all at the full protection, perhaps just before the holiday gatherings. It's still also for children, 2 doses, and then another 2 weeks until the immune system is fully launched. So we do want to continue to be cautious as we gather with our friends and families outside of our household. So consider people's vaccination status and celebrate as safely as possible. Just a little bit of non-COVID topic. As board members, you heard at our last meeting in early November, we are planning for a lot of exciting work in 2022. And some of it will be COVID work, but we have other work to do. And so tonight, I know you'll be considering the budget for our work. Besides supporting our budget submissions to the City of Ottawa and the Provincial Ministry of Health, I'm looking forward to connecting with you about how we reimagine our public health work into the future. I expect that the process to prepare a new strategy for Ottawa Public Health will involve meaningful engagement with diverse partners, community members, and clients. So I look forward to your guidance about this undertaking in 2022. And I want to end by thanking all the new and the continuing OPH employees who've persevered through such a challenging and now long period. The dedication of all the types of the Ottawa Public Health team members is impressive, whether they've been answering phones and emails and tweets or ordering supplies, helping onboard new people, addressing climate change and promoting equity and policy solutions to address determinants of health, answering questions of partners, supporting mothers with postpartum depression, helping people with dental abscesses, keeping syphilis and tuberculosis and other communicable diseases from spreading, or putting together financial statements and budgets. They are making a difference for the health of people in Ottawa, and I'm so proud to be part of their team. So I'm happy to take any questions now. Cela conclut mon rapport verbal. Il me fera plaisir de répondre à vos questions.
Thank you very much, Dr. Etches, and I think the board shares your thank yous to OPH staff for COVID and everything else that they do every day. It's been a tough almost 2 years now, but they continue to deliver, and we're very, very grateful for that. So going through the list, then we'll start with Member Tilley if you have any questions.
Just one came to my mind now then, Dr. Etches. So given the stress and the strain that your team has been through in this past year and a half, do you worry about, or have you seen possibly losing some of your staff to other departments, other avenues in life? Has that been a concern? I know some of us in this sector have certainly been discussing it as we continue to watch our staff leave for better opportunities, but also certainly we think some of the stress of the past year and a half hasn't helped. And the problem is we're just not finding the easy resources available to replace them. Has that been a concern yet, now that you've just thanked your staff for all they've done?
So many things going through my mind. First and foremost is our senior leadership team has been really trying to assess the impact of the pandemic on the team through looking at surveys of wellness over time. We've told you before, some of the most challenging conditions have been faced by managers as well. And we've been monitoring how people are doing and working on our Wellness at Work action plan with a Wellness at Work group committee. And they have excellent ideas, and one of them is to recognize people. So we are growing the different ways and making more efforts to find ways to recognize people and the different contributions they make. Our monitoring data has shown some improvements in some of the indicators. So the amount of overtime that people are working has dropped. The amount of vacation that people are taking has grown. The amount of sick leave has still been higher, but is trending down again compared to where it was. So long-term disability, situations are fairly stable, similar to previous. And in terms of people leaving, I think you will always have some retirements. We've seen a few retirements of people who have been really strong contributors, and we wish them well. But overall, I think that we're very lucky to have people who are dedicated to helping out right now in this pandemic. A lot of people have chosen to come work for us, even part-time or casually as they work other places, because this is work they want to do. I was able to talk to some staff in the vaccine clinics, and they actually find this quite positive compared to sometimes treating sick people. When we're in the vaccine clinic, we're trying to prevent illness, and I think that's refreshing for some. So what we're aiming for, of course, is a workplace that people feel treats them with respect and is providing meaningful work. And we constantly have to assess how we're doing and get input from the teams to make things better if that's needed. So I think we're continuing, to hear that it's been tough and people are tired and the recovery is not complete. We're not recovered. We're still responding. We still have recovery to do. But I see some encouraging signs that workload is coming around, though each transition causes pressure. So the transition to more children, the transition to up and down each period will come with the need to pay attention to how the team is doing. I don't know if hopefully that answers your question.
It's great to hear. Congratulations to the leadership team for keeping the staff motivated and content.
Thank you, Member Tilly. Member Pinnell, please.
Thanks, Dr. Verres, for your very interesting report. I don't have any questions, but I'd like to add, j'aimerais vous féliciter pour la reconnaissance Saphir, qui était si bien méritée. Vous et votre équipe faites vraiment une différence. Merci, félicitations.
Thank you, merci. Member Menard, please.
No questions, Chair. Thank you.
Thank you. Member Kavanaugh.
Thank you very much, Chair. I really appreciated the question from Member Tilly about the state of the employees. I think that was great to ask, because what I was going to ask about was mental health going forward, and the work we do on that. I think that's a topic we're talking about a lot. We're in the midst of 16 days of action on violence against women, so this is top of mind when I think of what the pandemic has done to people, and it has been a gender issue. So I just wanted to mention that and think about that going forward in terms of the recovery as we look to what people's public health needs will be. So I just wanted to pass that on. Thank you.
Thank you, Member Kavanaugh. Member Gower, please.
Thanks, Chair. No further questions for me.
Thank you. Member El Chantieri.
Thank you. Thank you, Mr. Chair, and thank you, Dr. Atchis. Dr. Atchis, one of the questions among other colleagues in the municipality is the new norm. How are we going to balance between the work public health used to do and the new with dealing with the pandemic, and if it's going to stay with us for, do we have a plan in place for the long haul? Especially now we start to hear more and more it's going to be longer than we thought.
One thing is clearly you can hear my emphasis on the vaccination. It is making a difference. We need to continue to make sure that as many people are vaccinated as possible, because it has changed how many people are dying from COVID and the pressures on the hospitals. So we will continue to need to have some capacity to continue to offer vaccination to people, whether it's booster doses, still first and second doses. If there's other versions of the vaccine that come along, this is work we'll maintain some capacity to continue doing in partnership with others. We know that there's a surveillance system that's needed, to look out for any new variants or what's happening. So the surveillance system capacity we will have to maintain in partnership with the province. And the people who work on following up with people who test positive, will need some enhanced capacity for COVID, beyond where we were prior to this pandemic. So our budget is projecting that. But we are, optimistically looking at less of that kind of response needed towards, into the summer of 2022 and through the fall, where we think that in previous years we've seen better ability to distance in the summer, less transmission in the summers, and then really bringing the vaccination coverage on to more and more of the population. We expect under 5s will be eligible in the new year. These will make a difference. And so it gives us that space to turn to other kinds of public health work. And I think we're excited that we have other work to do, but it is right now still early in the planning because most of the people involved, we want to shape this with our team members. They are still busy. So this will take some time. We think we won't fully get to reimagining, probably until past April in the spring. And we know it's work we need to do with our community as well. So taking the time in 2022 to hear from so many stakeholders and partners, and again, your guidance will be very valued, so that really we're setting ourselves up for the right kind of emphasis in 2023 with a new strategy, and by that time, hopefully even less impact from COVID, and then we'll be ready to go with newer ways of working and continuing in the ways that we know make a difference right now for our community.
Thank you very much, Dr. I really appreciate the fact we want to go back and focus on stuff you were doing before the pandemic. And we see, obviously, the pandemic took priority, but we like to, I don't want to forget about the mental health happened in my community with the 2 floods and the tornadoes, and now with the pandemic. I mean, the need is still there. What changed is the priority has changed, but the need is still there. So I'd like to see ourselves going back to what you were doing once, and you identify it in one time, is a need in those areas.
Yes, even now, our mental health and substance use, I remember actually Councillor Brockington telling me, every time you mention masks, you've got to mention mental health. You can't have the pandemic response without thinking about how we support the mental health of our community that's been so affected. So this team has been growing back their capacity over this year and is one of the priority teams, knowing that unfortunately we have had more people die from overdose, that this is also an urgent matter. And so, as we described in September in our relook at the priorities around mental health and substance use, we are continuing down that path to strengthen the partnerships so that we can increase the supports to our community, help people know what exists, because there are new services and supports. The one call, one click for children and youth, and access mental health addictions, and access MHA. These points of access to supports, people still aren't always aware exist. And then knowing we need to build more culturally appropriate services, and we're working with partners in the Guiding Council around a different kind of mental health crisis response that our community is calling for, supporting Indigenous, First Nations, and Métis partners to look at what they are wanting to support their community members to do. So we're part of the conversation, of course, on decriminalization in our community and what the alternative supports are that people need. We're seeing things progress. There's a collaboration I'm quite excited about with the city social services, with our healthcare partners like Inner City Health and others who can provide mental health care, with businesses and community residents in Lower Town. So an area that's reporting, quite a strong impact from substance use and mental health. And so this kind of partnership across health and social services, public health helping to monitor and measure and prevent and facilitate community dialogue. This kind of thing is a model for how we want to have alternatives for people, not having to call 911 and get a police response, but others, other 24/7 responses. You can see the interest and the work underway to come to better options for people. So we'll continue on that path.
Thank you, Dr. Ashes, and thank you, Mr. Chair.
Thank you, Member Elefanteri. Vice Chair, please.
Thank you, and thank my colleagues for the thoughtful questions and of course the thoughtful answers. And I have no further questions tonight.
Thank you very much. Member Kuche.
Thank you very much, Chair. My questions are with respect to Dr. Etches, with respect to I said 8,400 children had appointments or had been vaccinated, and they are the true heroes. And thank you for cheering that. Has that uptake been as you predicted, or what's your has it been as you predicted?
I'm very, very encouraged by that because in Ottawa, that's 11% of the people who are between 5 and 11 in our community in 3 days. And so if we carry on with this rate, we'll have reached 70% of this population in under 3 weeks, which we were hoping to be able to see anyone who wanted a vaccine, have that vaccine in 3 to 4 weeks. So the pattern with other age groups has been once you hit about 70% uptake, it's slower after that. So normally then we see it takes maybe another 2 months to get up to 90%, but we've seen it climb in that way. So this is a good pattern of uptake, and I think will help protect the children and their families. Yeah.
Okay. When you mentioned some neighborhoods with lower vaccination rates, and those priority neighborhoods, are they accessing the neighborhood's clinics to vaccinate their children? And when will you be able to share that vaccination coverage for 5 to 11-year-olds by neighborhood? When will we be able to see that?
Usually our neighborhood information is updated monthly. So then you'd be seeing the December data. Well, you could see the end of November. Actually, that would capture some 11-year-olds, the end of November, first week of December, or the December data will be available about the first week of January. I shouldn't overpromise because that's some time that people need off probably during the holidays. But what I can tell you is that it is showing, I think, in whatever data we can look at ourselves. We usually partner with the Ottawa Neighborhood Study. There is a difference in uptake between neighborhoods with more advantage and less advantage in the bookings. But that doesn't tell the whole story yet because the neighborhood clinics don't need bookings and the school clinics don't need bookings. And so we'll need to examine this as we run the school clinics and see overall what's happening over time. But we are focused on trying to measure if there's a gap and address that gap with community leaders and other partners in our schools. I want to thank the school boards for being open for us to use their sites.
And depending on what that analysis gives, there'd be targeted or different outreach done in those neighborhoods, in those communities?
Yes, that's the way we're trying to work all along. And so certainly the 10 that have experienced the greatest barriers so far, we have an enduring presence. So we will continue to build on that. Yeah.
Okay, just one more question. With respect to contact tracing and the positivity rate in Ottawa, are we able to meet our contact tracing targets in a timely manner? And I'm kind of thinking ahead to the new variant and the holidays.
Yes, in fact, the manager who works on this, Denise Hebert, she was speaking to me about looking ahead and seeing the holidays and making sure we have enough coverage. And so it's on her mind. We still sometimes need to bring on more people. So this is a constant sort of assessment. Right now, we are following up with everyone who tests positive and their contacts, pretty much meeting that target of 90% within 24 hours, or just under 90%. So it is sometimes the case that people, don't get back to us right away. Like there's always a little bit of a gap. We're never at 100%, but the provincial target's 90%, and we are typically, that's what we monitor to make sure we have the capacity to do that. We also have ways to automate follow-up. So if for some reason the number of people testing positive really grows, we have also automated systems to notify people and reach out with information about what's needed. And do the follow-up over time as well. So there's different tools we can use as well.
Okay, thank you. I said that was my last question. That was not true. I just thought of another one. Do you have any data on the flu vaccine? We're relying on multiple channels of delivery, the family doctors and pharmacies and clinics. How are we doing with respect to the flu vaccine?
Yes, I'm just thinking about who might be in the best position to add any more details. We have been offering flu vaccine to those who may have barriers accessing it somewhere else. We hear the uptake has been pretty good among older adults because people are looking for the higher dose vaccine sometimes for older adults, and it's become sometimes hard to find at pharmacies, as the provincial supply that goes to pharmacies is being used up. So I do invite somebody else if they would like to speak to this vaccination, the flu uptake. We have been running mobile clinics with partners.
But do you have any data with respect to how many residents are accessing pharmacies and their family doctors?
It would be mostly pharmacies and family doctors that would be where most of the flu vaccine has been given. And usually the bulk of the flu vaccine is given by the end of November. So I think what we're looking at is most of the flu vaccine that's going to be given has now been given. People have accessed their flu appointments. And that is actually good timing because it means the pharmacies, having given flu, and family doctors are now coming into a time where they have more capacity, perhaps, to help out with COVID boosters. So if you're in one of those populations eligible for a booster shot for COVID-19, I do encourage you to reach out to a pharmacy. They are able to do that more and more.
Yeah. Okay. Thank you, Dr. Etches. Merci.
Now, you're sure that you ask question?
Yes, Chair.
Member Banham.
Thank you. Just wanted to say no questions. Thank you so much for the update. And from a community standpoint, I think that it's very obvious, like I was speaking about with the Alpha conference, that it is more widely acknowledged the role OPH can play. And I have to give a shout out to Louise Gilbert, who I met with, who has been thinking about very creative and innovative ways to combat maternal mental health in her role. So I do have to say that even though we know that the road ahead is still long in terms of COVID, I've seen firsthand the innovation that the OPH staff are doing on the ground to ensure we can start to address some of the other, things on the mission list. So just want to give that brief shout out and thank you so much for all the work that OPH staff are doing. Thank you.
Thank you, Member Banham. Just a quick comment, Dr. Etches. One of the things that I didn't mention from the visit and the tour of the vaccination clinic with Marie-Claude Tricot is just how happy everybody seemed, how excited they seem to be. I mean, they've been giving vaccinations for a long time now. They've been working long hours, but the energy in that hall was just so positive. They knew why they were there. They knew it was important, the job they were doing, and most importantly, they very clearly wanted to make it as comfortable a situation as possible for the kids. Very aware that while kids have had vaccinations before, this is different in terms of just the atmosphere and the mood, and they were all, everyone I spoke to was committed to making it as positive experience as possible for our kids. And so everybody has pretty much said it around the table, but I let me add my voice to that as well. I mean, the energy, the commitment, the creativity of OPH staff never ceases to amaze me. I mean, 2 years on, they're still coming up with great ideas, following through on them consistently, getting great results, as is our community. I won't say which public health unit said this to me, but on the first day when the numbers were rolling in about vaccination appointments booked, not that this is a competition in any way, it's not, but the chair of the other said, "You guys are crushing it," was the text that I got. And we're doing that. It's a beautiful partnership between OPH staff and the people in our community. So just a big thank you to everybody as we end this year and enter a new one, and hopefully with better results going forward, and a more positive outlook. So thank you, everybody. And can we vote to receive the report of Dr. Etches, please? Received?
Received.
Thank you. Next up, we have the item number 3, which is the 2022 draft operating budget for the Board of Health. We have a presentation from Svetlana Valkova, and then we do have one delegation as well. So we'll have the presentation from Svetlana, and then we will take the delegation. And then if you can hold your questions for staff after the delegation, please. I'm going to turn it over to you, Svetlana. Thank you very much.
Thank you, Mr. Chair. Good evening. My name is Svetlana Valkova, Manager Performance and Corporate Services, and I'm here tonight to provide an overview of the 2022 budget. You will recall that when we tabled the budget with you on November 1st, we communicated several avenues for residents and stakeholders to submit questions or comments on the draft budget. This included a dedicated email address, social media, and telephone number. I can report that as of this afternoon, no communications have been received through any of these avenues. Tonight, as you consider the 2022 draft operating budget, we will provide a brief overview since our last meeting. There have been no changes to the 2022 budget assumption, which incorporates an inflationary and growth-based increase of $1.07 million from the City of Ottawa, assumes a 0% provincial-based increase from the Ministry of Health, assumes all one-time requirements will be needed for the entire year and are provisionally funded at 100%. And lastly, does not include provisions for activities related to providing COVID-19 booster vaccines to the general public. On November 3rd, the Ministry of Health approved in full Ottawa Public Health's request for funding for extraordinary costs for a total of $84 million, broken down into $55.7 million for vaccine program and $28.4 million for COVID-19 general response. While the pandemic response is continuing, the 2022 budget will allow us to do more work on non-pandemic related services, including responding to the overdose crisis and mental health concerns, providing healthy growth and development, dental, sexual health, harm reduction, and school immunization programs. Our services and programs are adapted to the needs of our community, and we provide equitable access across the whole city. This budget also includes supports for actions to continue to advance the equity, inclusion, diversity, and anti-racism framework. The next two slides, which were presented during the tabling of the budget, provide a high-level summary of the 2022 budget changes and include base pressures for future negotiation of collective agreements, which total 1.07 million, one-time pressures of 47.7 million for COVID-19 support outlined in the budget report. The next slide provides the funding sources, which include base pressures being funded by the City of Ottawa and one-time pressures being funded by the Ministry of Health. Once the board approves the budget tonight, it will rise to council on December 8th and for final city approval, and then it will be submitted to the Ministry of Health for consideration. And with that, that concludes the presentation, and we welcome questions at this time.
Thank you very much, Svetlana. We do have one delegation before we go to questions, and that's Councillor Mathieu Fleury. Are you with us, Mathieu? There you go. You know the rules. You have 5 minutes. Thank you very much and welcome.
Merci, Monsieur le Président, et merci à Santé publique. Premièrement, j'aimerais débuter par féliciter toute l'équipe. Je suis ici en aucun temps. Pour faire une critique de l'an dernier ou de la réponse COVID ou de l'équipe en général. Je pense qu'ils font un travail extraordinaire, fabuleux. Moi, j'essaie de penser à l'avant. Donc, je me questionne un petit peu au niveau des besoins de santé mentale, toxicomanie particulièrement. Puis j'aimerais avoir un petit peu plus de compréhension. Comme vous le savez, au conseil municipal, dans quelques semaines, on va avoir l'ensemble du budget, y compris le vôtre. Puis, un des dossiers qui est pertinent d'après moi et important, c'est comment on répond de façon en temps réel aux besoins de santé mentale. On l'a vu de façon directe au niveau des services policiers puis de leur budget. J'aimerais comprendre dans votre aperçu du budget puis des besoins de la communauté où se positionne Santé publique pour ce que je vais appeler comme le 4e pilier de réponse immédiate. Puis j'aurai un petit suivi après, Monsieur le Président, si vous me permettez.
Oui. Merci pour votre question. Votre intérêt, c'est tellement important. Il y a des personnes, nous avons perdu et c'est tellement important. Alors, pour Santé publique, comment j'ai décrit notre rôle, c'est premièrement de commencer avec la surveillance, la méthode de mesurer la situation, d'informer les différents programmes et d'évaluer les interventions. Alors, nous avons travaillé maintenant avec beaucoup de partenaires, les hôpitaux, d'autres membres de la communauté, de créer quelque chose qui je manque peut-être le mot, mais d'écrire la situation comme un dashboard. Je m'excuse quand c'est le mot pour dashboard, je manque en français. Mais d'avoir le nombre, les chiffres, d'informer les différentes réponses et aussi de mesurer les changements quand on introduit d'autres programmes. Ça, c'est un rôle de santé publique. C'est aussi de travailler avec beaucoup de différents partenaires parce que la santé mentale et l'utilisation de substances, c'est influencé par beaucoup de différentes causes. Il y a des difficultés quand les enfants ont une expérience difficile, ça peut affecter leur santé mentale et l'utilisation des substances après. Alors, Santé publique a un rôle dans la prévention de l'utilisation des substances. Ça, c'est une de notre priorité avec notre système et le programme de santé bébé, santé enfant. Mais pour maintenant, quand il y a déjà des populations avec difficultés, on a aussi besoin de travailler plus, de diminuer la stigmatisation qui est une barrière d'accès au soutien que les personnes ont besoin. Alors, nous avons un plan créé par beaucoup de partenaires qui priorisait réduction de stigmatisation. Et ça prend l'entraînement, ça prend discussion, dialogue avec beaucoup de membres de la communauté, le décriminalisation aussi, c'est une partie de réduire la stigmatisation, de créer un environnement où les personnes peuvent avoir accès aux services. La prochaine priorité après ça, c'est d'avoir une approche où on a un système qui est ouvert aux gens, n'importe quoi l'utilisation de substances. Auparavant, c'était commun d'avoir un système où la santé mentale est traitée par une partie et l'utilisation de substances, c'est un autre programme et on ne peut pas avoir accès aux les deux à la même fois. Ça change et c'est important de soutenir toutes les individuels s'ils continuent d'utiliser des substances ou non et d'avoir un système de la santé où on peut accueillir les gens. Alors ça, c'est aussi un effort de santé publique d'augmenter la capacité de nos urgences, nos hôpitaux, les médecins primaires, de créer un environnement où il y a soutien pour les personnes qui utilisent les drogues. Et la dernière chose, c'est qu'il a besoin d'avoir accès aux services. Service qui est intégré, pas juste avec le système de la santé, mais le système social. Parce que c'est souvent le logement qui est nécessaire d'avoir santé, de diminuer l'impact de l'utilisation de substances. Et il y a un meilleur système maintenant pour accès les services de santé mentale et l'utilisation de substances. Il y a un point d'accès pour les adultes et un point d'accès pour les enfants. Mais la prochaine étape d'intégrer plus avec les services sociaux, ça c'est une nouvelle stratégie. On peut augmenter plus. Et c'est où santé publique, notre rôle, c'est de travailler avec les partenaires, d'aider avec ce type de collaboration. Et il y a une opportunité maintenant à Basseville de créer un projet avec les résidents et avec les entreprises où on peut démontrer une nouvelle approche. Et c'est où on peut travailler comme santé publique, d'aider avec la communication, les données, les partenariats. Alors, est-ce que ça aide de comprendre?
Oui, non, j'apprécie que vous. Oui, absolument. J'apprécie que vous donnez le contexte complet. Peut-être un petit suivi rapide, puis je vais aller en anglais juste pour mieux m'exprimer moi aussi. We've heard of the need to have in real time 911 mental health response. And we've heard that at the police board. We're faced with those challenges. And I appreciate what you're saying around we have to start with a pilot, and Lower Town's a good example of that effort. I'm curious to see though, what is the role of public health? Like, do you see, and I don't know that is a position, but just curiosity, do you see public health with local nurses and professionals being able to be on the ground in real time and responding, or is that done through, in your mind, a partner agency?
Councillor, just quickly, we're on the budget, eh? I'm
well,
just
to me, it has
question
budget.
Impacts on the budget. I'm not saying it's a bad question, but that's the topic we're on right now.
Well, I appreciate that, Mr. Chair. The reason I'm coming here is because there was a report by the Coalition of Health and Resource Centers, which had figures attached to it. We've heard that very directly at the Police Services Board, and I want to educate myself. I want to know where public health is seeing if that is the role of public health, and if so, what are the budget pressures relating to that?
So we are in our budget for 2022 prioritizing mental health and substance use as a significant burden in our community. And the way we are going to address that is through our surveillance and our monitoring system in partnership, creating dashboards to evaluate and assess where to focus interventions. and to evaluate those interventions, especially looking to see about equity as well, where there are populations with less advantage, learning from what we've seen with COVID. So that's epidemiologists, that's community engagement work, to work with the African Caribbean Black population to understand how do we, do the kind of work to describe what's needed in a culturally appropriate way. The work on stigma, that's a lot of our communication staff. So we have, really excellent teams in health communications and health promotion. Part of what we are doing is working with, again, partners, CAPSA and others, but a communications campaign to help understand more about substance use. Like why are people using substances? What are the root causes? What happens? This isn't about a bad choice. This is sometimes about a way people have been able to make it through some pretty tough times. And so trying to build understanding and community compassion so that people are able to just talk about their substance use and, again, access services. So that is some of the resourcing that we have in our budget. The idea that we need to meet people where they're at and use more harm reduction approaches, working with, again, our hospitals, our emergency rooms, our primary care, so that people, when they come in for health reasons, if there's substance use, they're welcomed, that there are options for a diagnosis, for treatment. People don't always know there's effective treatment for substance use. That is partnering, that's sharing information. And we do run a harm reduction program. So some of the city financial support for public health goes directly into a harm reduction work. So that is in our budget. For the supervised consumption service and supporting people with the supplies they need so that they don't get HIV or hepatitis C, that is in our budget. When it comes to that third area of focus, integrated health services and integrated with social services, that's more of a facilitating role. So it's the nurses that may be helping to bring people together, but it in the end, it's not, our nurses aren't counselors. They're not mental health counselors. They're not prescribers of mental health, promoting medications. That's not our role. That is the healthcare system. So we would be often helping people access, like knowing where to turn. And when it comes to the social services, again, we're not housing providers. That is not an area of expertise, but we want to serve to get people connected and create a system where people are able to access what they need. And so it really is partnering by which we'll get the best results. So partnering with the healthcare providers and partnering with our social service providers, where sometimes we're in the middle to explain the importance or to advocate for the policy changes to make that easier.
Thank you. Thank you for that. I appreciate your further clarification on the integration and facilitation role in that spirit. My last question is, in reference to community health, specifically gaps that were identified pre-COVID in both Overbrook and Vanier for primary care. And I'm looking, so I'm not seeing anything in the budget, and I understand that it's a complex submission that is underway by a number of community agencies. I'm wondering if you could just provide some advice on how you see the kickstart to a community health space in that geographic area. I'm
quite hopeful that we can do better than we're doing now, right? We need to, and I think there are a lot of voices saying this, and access to primary care is one thing that is kind of a foundation. So you are pointing to some areas where we are learning there's just gaps in access to primary care, and then the mental health and substance use supports that might be needed. So one thing I'm hopeful about that's new on the scene, but not totally worked out, is the Ottawa Health Team and the Ottawa East Health Team. kids come first as well. I think they're actually leading the way in terms of supporting children in a more integrated way. But for the general population, the other health teams, they are taking more of a population approach to say, okay, in this part of the city, here's this population. What do we need to do to best meet their needs? And it's going to lead to new interventions at some point. It's just early days still for that. I think, again, our role where I think we can help is measuring the need, pointing to the gaps, and helping make those business cases that ultimately it's for the Ministry of Health to support healthcare.
Okay. I really appreciate the clear answers. Thank you, Dr. Etches, and thank you, Mr. Chair.
Thank you very much. There are no other delegations. We'll move to questions, though I think I'm going to ask Councillor Menard, just out of abundance of caution, before we move to members' questions, perhaps she can move the motion to allow us to go past 7 o'clock if need be. Councillor Member Menard, rather.
No problem, Chair. I'll just pull it up here. All right, so the motion is let's to adopt reports. Sorry, Chair. Here we go. Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Okay, thank you. Carrie?
Carried.
Okay, thank you very much. Again, just not an invitation to go past 7 necessarily, but if we need to, then we're covered. So in reverse order then, we will start for any questions or comments from Member Banham.
I have no questions. Thank you.
Thank you very much. Next is Member Cloutier, please.
Thank you, Chair. Just very briefly, just one question. Svetlana, first, thank you very much for you and your colleagues in the work you do in very difficult circumstances, pivoting and adapting. Thank you so very much for the outstanding service you provide to the residents of our city and to Ottawa Public Health. On the 7th page of the budget document, cost shared, that I'm referring to the $1.07 million budget pressure, which is actually made up of two numbers, $5,600 reduction of one-time COVID, but an increase of $6.6 million of cost shared core programs or something like that. What is that $6.628 million increase?
So 1.07 is the overall cost of living increase as determined by the collective agreements. And we have restored some of our core services such as dental, mental health, substance use, school immunization. And we're expecting that our COVID-19 response will require less focus in 2022. And as a result, you can see an increase in costs in our cost shared core programs to reflect the return of our staff to these programs.
The way I think about it is that the COVID-19 baseline just above it was really made up of a lot of our resources that go to our full-time permanent staff. And it's a shift between the COVID response back to our core work under the Ontario Public Health Standards in a prioritized way. But it's now allocating their time back into that cost shared work.
Okay. Thank you. Thank you both very much. That was my only question, Chair.
Thank you very much. Vice Chair, please.
Yes, I agree. Thank you for the thoughtful budget. And it is a challenging time to be thinking about what is in the year ahead. I too had questions. I think it's on the same page as Member Cloutier. But I noticed in the Ministry of Health Programs and Standards, so there's a budget line for COVID base and then COVID-19 one-time expenses. And so COVID base would take into account the contact tracing that we believe will be ongoing. So is that our best guess? And is that part assured to be covered by the Ministry of Health as well? Or is it just the one time that we're sort of assured that they will cover? I just don't know what direction's been given to the public health units for next fiscal.
Yes, either way, I think I'll start, but Svetlana might be able to round out my answer. So the COVID-19 response is funded, it's true, in two ways. One is out of our base, which means we've taken people who normally do other work and they're working on COVID, and that province hasn't given us any extra money for that. They just expect that that's what we would do. We would use some of our existing base budget to respond to COVID, and that's what's in the first line, COVID-19 base. So that money will come through because it's in the base. So we aren't worried about that line. Given we expect that our budget will be accepted in terms of the base. And then when it comes to, that's just not enough to meet the demands of the COVID response. We have a lot of work even beyond that, all of the vaccination and the case and contact management, the outbreak management, the communications, the surveillance, the schools work, all of this is the one time, which is 100% provincially funded, and we do believe will continue. So that one, they haven't given us a number. They haven't said we will give you this much or this, but they have said they will support our COVID response in one-time funding like they did for 2020, like they are for 2021. They've said to continue into 2022. So we do have confidence that this will come through. Where the uncertainty still lies, Member DiGiovanni, is that this amount could change based on the COVID situation. So it could change if they expect us as Ottawa Public Health to do a lot more of the booster shots. We'll see. I'm very optimistic that the pharmacies are going to do a lot of the COVID-19 booster shots. So that will help. It could change if we have a lot more case management work and a lot more outbreak work to do, that we'll have to adjust, and we would be reporting quarterly to you about the needs. Svetlana, does that make sense?
Yeah, you answered this very well.
Thank you. That's really helpful. I just didn't understand those two pieces. And so this time next year, we should have a better idea of what the ongoing base amount would be, and then what adjustments we can make in our core programming from that.
And or ask for a new COVID program funding line. I'll just plant that seed for you. If this is new work to do, I think we need to think about that as a public health system. What is the enhanced level of immunization capacity that we need potentially? What is the ongoing case management work? So yes, but we'll have a better idea of what to propose for 2023 this time next year.
Perfect. Thank you. I have no further questions, Chair.
Thank you, Vice Chair. Member El-Shantiri, please. Okay, seeing no questions. Member Gower.
Yeah, thank you, Mr. Chair. The province pays for 70% of our core programs, but we're seeing each year there's a 0% increase to that amount. I know this year you've been able to absorb it, and with the additional funding for COVID, perhaps it's less of an issue, but do we have any indication that that 0% will change in future years? Or is there any risk in future years that not having an increase to that base, or what risk does that present in terms of the ability to maintain core services going forward?
It's hard to answer that one definitively. Obviously, it's a speculation about provincial funding priorities and investments. What it means in reality, if we do not get a percentage increase to cover the cost of living, the obligations we have to pay our staff increases under our collective agreements, it means that we have to decrease the positions in our budget to balance and shrink the size of our team. Because most of our budget is made up of paying people. And we have every year, we look for efficiencies. Every year we think about, can we spend less on any materials, any, ways of promoting, can we do things more efficiently, electronically? But the quantity of resources to offset, the growth needed in salaries is just not sufficient. So it does mean shrinking the team and having to prioritize our work or do things differently.
I think it's another thing we'll have to look at for future budget years and put some pressure on the province to increase that base funding and not freeze it at 0%. I also want to just ask, the city support costs at $10 million. Can you just give a general idea of what's included in that $10 million amount?
Yes, Svetlana has negotiated a service level agreement that covers a lot of what happens behind the scenes in terms of the support. Did you want to speak to that anymore, Svetlana?
Yeah, so we have a service level agreement with the City of Ottawa where they provide a lot of the administrative support, such as payroll and IT related support. Anything that is administration related. And so this allows us to spend less and have less staff on our end to support this activities. So yeah, so this is 100% city funded at this point.
And that's included within our 30% city funding envelope?
This is actually just a little bit above the 30%.
Okay. Okay. Thanks very much for clarifying.
Another example of the kind of city support would be legal support. So you can imagine through the pandemic, we've had the support of Omar Ansari quite a bit, and sometimes others. And so rather than having to hire an external lawyer, this is part of that funding bucket. It's really in kind.
Okay, thank you.
Member Kavanaugh, please.
Thank you very much. Good questions so far. I was at the subcommittee on IT earlier today, and they were talking about the fact that Ottawa Public Health is part of their network and what they support. So I heard about that. It's fairly intertwined. We were asking this question in terms of cybersecurity because, of course, that's a concern. And but they're maintaining it and taking care of that, and which is good news since this is a time when we have to worry about things like that. In terms of programming, in the getting back to normal, one of the things I had heard about that was popular but had to be put to the side was things like prenatal classes and classes for such as that for young mothers. Are we going to be returning to programs like that? Are we able to put that in our budget?
Yes, yes, that's one of the areas we're prioritizing support to early childhood development. We have a new program manager actually leading the Healthy Growth and Development team. I don't know if Menar is on, if she would like to speak to this work, but we've maintained support to people who are pregnant or after the birth of a baby, or children under 5 who are reporting more risk factors for challenges to the child's development or the well-being of the family. And we know that we need to think about the prioritization of families with greater needs going forward still. That work that we do across the whole population, we've tried to maintain through platforms like Parenting in Ottawa website that can reach people with information. There are partners that are doing prenatal classes that we've been promoting, and I think there's ongoing policy work. Again, the kids come first. Health team is something we really see as an opportunity to think about this collectively of how do we have the greatest impact we can as we work together to support people prenatally and postpartum. So I think that we will probably, public health will be part of supporting clients with the greatest needs, and collectively looking across at other supports to families. We've had things that just are more adaptable to young mothers, parenting circles, we've called them. These are the kinds of things we'd like to return to.
Excellent. I appreciate that. I think that's where we really make a difference, is right at the very beginning to set families off on the right step. Well, thank you very much. That's all.
Thank you very much. And next is Member Menard, please.
Okay, thanks very much, Chair. Thanks for the budget presentation. I'll just take you through a few of my highlights of the document and ask questions that way. One of the lines in the budget talks about the fact that many OPH programs had been suspended as a result of the public health measures implemented. Some of those were restored. Some of the core programs were restored based on community need and where there was a measurable health burden. I'm wondering to staff, and the report seems to indicate this, that there's still some core programs that are not being offered, and what those are, the impact of those, if you could start with that.
Yes, just checking with Svetlana. I'll think again, happy to speak first, and Svetlana, just jump in if there's anything you want to add. The major burden of illness in our community is from chronic disease, heart disease, cancer, arthritis. And we actually have been doing very little chronic disease prevention and promotion through the pandemic. We've tried to maintain messaging around looking after ourselves by staying active, by eating well. That helps all of us through hard times with these help mental health. It does help with chronic disease prevention. But the work that truly makes a difference is policy work to make the environments more supportive of being easier to be active, to have the health promoting food, and being able to afford food. All of these things are best tackled through policy work. And so again, we have maintained a little bit of capacity, but very little, through working with the official plan process and the city plan that is shaping environments that will shape health. But we need to come back to more chronic disease prevention work, and we have a lot of ideas. I think this is probably the area most ripe for reimagining how we can work with neighborhoods, how we can influence policies. So a lot of things our team is going to tell us, our community is going to tell us how we need to work on this kind of bigger burden of illness together. Some of it's improving healthcare, right, and prevention in the healthcare system, and how can we support our colleagues to do that, as well as building the environment. Some of it's housing policy, some of it's social service policy, and the relationships are there. We've been working closely with social services through the pandemic. I'm very hopeful about new ways of collaborating to meet community needs that we'll get at this. We are learning from the vaccination hubs in neighborhoods about the value of neighborhood-based approaches, building on that to address mental health and substance use with community leaders, with peers. Could look at chronic disease that way as well. So these solutions will reemerge again and take shape in 2022 into 2023. I think the other kinds of work that we haven't done as much of is some of our health protection work focused on the environment. A lot of our inspection work has drastically decreased to become risk-based. So while we were always working to get into every type of food premise, whether low risk or high risk, on a schedule, we are taking a bit more of a risk-based approach at the moment. And so I think I'm not even touching on the things where we've stood up sexual health service and dental and we see greater needs and we have to catch up. Those are coming, but I'm speaking to the areas where there's actually just not much work happening in them right now. And I don't know, that gives you a sense of it.
It does. It's very helpful to know some of the areas, as a result of what we've been dealing with, the crisis we've been dealing with, both with COVID, overdose crisis, and others in our community, where we've had to focus resources. I'll touch on a couple other areas. The forecast mentions that it's subject to change due to factors such as school reopening, other potential waves, other requirements or unpredictable circumstances. And then the document also goes through kind of the initiated and potential reduction of additional of resources as we proceed through 2022. In terms of some of the response, right? We're just kind of saying we may have additional resources down to 75% of existing levels, then 50% at approximately July. And then the last quarter, we're estimating potentially down to 30%. And so for those two kind of competing issues, we have a new variant here. It's arrived. You led your comments with it, Dr. Etches. We could anticipate potential reduction in services, but we're not sure. And the forecast is quite unclear about how much work will be there. And so I just want, if you could expand on those comments a little bit. The budget is not easy because you can't predict the future, and this has been such a volatile situation. On those points, if you could expand a little bit more the current budget and how we're planning for those scenarios.
Yes, so the priority is vaccination and completing the vaccination as quickly as we can. Each time there's a new group that's eligible. So 5 to 11, then under 5, booster doses where those are becoming more clearly needed. And if we can keep going with that, that should mitigate how much severe illness is in our community. And so the outbreaks, the case and contact management is the next sort of step. If people aren't vaccinated or there's still enough COVID in the community, it's reaching vaccinated people, then this team will be needed. So if there were to be a greater demand, more COVID in the community, we know we will probably have to use other public health measures that each of us in the community then help, to control COVID transmission. So we've never, through every surge, relied only on case and contact management to control it, because it's after the fact. It's after people test positive. There's already been the transmission. What's really brought COVID under control each time is that people decrease the number of close contacts they have. So they're wearing masks. We're thankful that people are continuing to do that. We've managed Delta through this fall where many countries have struggled with Delta. We've managed it, the masks, the distancing. So we'll use those tools. We'll ask people to be cautious with the number of close contacts they have, to keep things manageable if there was to be another surge in COVID. If it continues at a higher level, we would keep our team in place, and we would expect the province would support that based on the direction they've given us to respond as we need to. So we would come back to the board saying we're overspending to maintain these services, and we're expecting the revenue offset from the province. So that's what how we would handle that.
Thank you for that, Dr. Etches. And I guess my thoughts about the OPH budget, my concerns for a couple of years now anyway, is that there is so much value here in preventative work, in work that can reduce other budgets in the city, that has a direct effect. And that this is such an important line item in our city, both the provincial funding, but also, as Councillor Gara mentioned, that the frozen provincial funding, but also our city funding. We increase this one by inflation, but because we have such a low base budget, that inflationary increase is very low. And for all the needs that we're seeing in our community right now, which you can talk about the fact that, the psychosocial impacts of the pandemic, the mental health impacts, the harm reduction, overdose concerns that we're seeing, some of the basic services, as you mentioned, around chronic disease. These are things that have been heightened and have require more public health intervention, more upfront intervention. And I have the utmost respect for this team, what they do, close friends that work in OPH, and they tell me what they're doing on a regular basis, and it is incredible work. My issue is not with OPH or budget here. It is the city budget as it relates to OPH. We are not investing enough in public health, and we're going down a path that if we don't invest more from the city budget into OPH, we're going to see other line items affected and more difficult to keep up with. So the million that we're getting extra from the city chair is, and Dr. Etches, is really just it is a baseline, fairly status quo increase, but we've seen the world totally change and shift in our city. Our outlook has changed, and the recognition of the benefit of public health has only heightened. And so I look at our budget and I see things, like the increases to kind of road expansion, which again does not help chronic disease prevention, or our policing budget increases, which does not help in terms of the front end mental health response that we need. These are things that I compare and I contrast the differences in the increases of those budgets from the city side, and we've got it backwards. And so I'm going to support the budget as it is today because I support this team, I support public health, but I want the chair and members to know that there needs to be more of a push of an ask at budget time for this group, for the work that's being done here in comparison to those other groups, because this really matters, is important, and affects so many other budgets. Not that they're not important, but the effect downstream here is very, very large. And so, Chair, I appreciate your work, and Dr. Etches and your entire team. And I'll support the budget today, but I need to make these comments because I find our approach needs to shift in this city. And I think a shift is coming. I think people are recognizing that, this way of thinking needs to start to change, and that I'm hopeful.
Bernard, I do need to ask you to wrap up.
I'll wrap up. I'll wrap up, Chair. I guess, just I'm seeing a shift in the public sentiment, and I think, after 2022 and into 2022, that public's going to be very clear on priorities, and it hasn't been what this city has been budgeting for on those large items. So appreciate your work, and thanks very much, Dr. Etches and everyone.
Thank you. Next is Member Pinnell, please.
No comments at this time. Thanks.
Thank you. And last but not least, Member Tilley.
First of all, a great job and a high-level presentation to the board, Svetlana. Thank you for that. And just member De Giovanni covered my question, which was just and the response. It's good to hear the assurance that the province will continue to support us through the pandemic. So that was it for me. Thank you.
Thank you. Just a quick comment on my part, and it's to Svetlana and her team, and you know, doing a budget with COVID and public health is a little bit like juggling at the circus, and your team has done a great job in terms of you know, working with the city, working with the province, getting those commitments, along with Dr. Etches from the province, that they will cover our additional costs that are COVID related. So I just want to take the opportunity to thank you, because it's no easy thing. And I think what we're hearing from the board, though, and Dr. Etches spoke to it a little bit, is, you know, as things move and shift over the coming year, we are going to be looking forward to those regular updates about where we are in the budget. And we need both you and Dr. Etches to signal as soon as possible if you need help, if there has to be advocacy work done with either the city or the province. I think Member Gower raised a very valid point. We have to make the point, and we have in the past, and we'll do it again, that you know, we're looking to the province to cover those cost of living increases. It's not acceptable to keep on leaving it at the base level. I thank the city for stepping in, as it has for a number of years, to cover that difference. But you know, I think we can all agree publicly that the province should be doing that, and we'll continue to advocate for that. So thank you for raising that point, Member Gower. Again, I hope everybody will support the budget. We will now ask you, Member Menard, to go through the roadmap, the budget roadmap motion, if you will.
Will do, Chair.
Chair, could we ask Vice Chair De Giovanni to take over at this point?
Yes, sorry, yes, but yes, good point. Because I have to recuse myself from one of them. So if I could ask, while you're doing that, Vice Chair, if you could call the vote on each individual line item, and that will give me the opportunity to step away from the vote when necessary. Thank you.
Will do. So with that, I will ask Member Menard to introduce the motion.
Okay, thanks very much, Chair. And it's on our screen as well here, that the Board of Health for the City of Ottawa Health Unit approve the 2022 draft operating budget for the Ottawa Board of Health, outlined at document 1 as follows. A, page 5, Ministry of Health Programs and Standards.
Carried.
Good. Carried.
Sorry, no.
The next line.
Yes, thank you.
Okay. B, page 11, user fees.
Oh, I think we need to go back to page 5 and sub-bullet all of those out, Member Menard.
Yeah.
Okay, we're going to carry each one. Sounds fine. Page 5, Ministry of Health Programs and Standards. 1, COVID-19 base.
Carried.
Carried.
2, cost shared core programs.
Carried.
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 3, Ontario Seniors Dental Care Program.
Carried.
Carried.
4, Healthy Babies, Healthy Children.
Carried.
5, 100% city programs.
Carried, and we'll note that the chair has stepped away. Carried.
Fantastic. 6, miscellaneous programs.
Carried.
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 And 7, COVID-19 one time.
Carried.
Carried.
And B, page 11, user fees.
Carried.
Carried.
Okay, upon the Board of Health's approval of the 2022 draft operating budget for the Ottawa Board of Health, direct staff to forward the report to Ottawa City Council for consideration on December 8th, 2021, as part of the City Council's approval for the City of Ottawa 2022 draft operating and capital budget.
Carried.
Carried.
And 5, upon approval of the 2022 draft operating budget for the Ottawa Board of Health by the Board of Health and the Ottawa City Council, direct the Medical Officer of Health or delegate on behalf of the Board of Health to forward the 2022 annual service plan and budget submission to the Ontario Ministry of Health for consideration based on the approved 2022 operating budget for the
Ottawa Board of
Ottawa Board of Health.
for the Ottawa Board of Health.
Carried.
Great.
Carried.
Over to you, Chair.
Thank you very much, Vice Chair, and thank you all for supporting the budget. And again, thank you to Dr. Etches and Svetlana and the whole team for putting it together in very, very challenging times. Member Menard, can I ask you to move the motion to adopt reports, please?
Yes, Chair. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the report titled 2022 draft operating budget for the Ottawa Board of Health be received and adopted.
Carried. I don't believe there are any motions requiring suspension of the rules. Are there any notices of motion for consideration at a subsequent meeting? Okay, seeing none. Can I get you to move the confirmation bylaw motion, Member Menard, please?
Yes, Chair. Be resolved that confirmation bylaw number 2021-6, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of November 29th, 2021 be read and passed.
Right.
Great.
Are there any inquiries? Okay, seeing none. We needed the motion at 7:01, so we did go past 7 o'clock. It's early in the holiday season, but this is our last meeting before the new year. So I want to wish everyone a happy and safe holiday season. It may or may not be a challenging one. We'll find out in coming weeks, but I think Dr. Etches gave us all good advice about continuing to follow the protocols and the processes the public health puts forward. And again, I wish everyone an opportunity to take a chance to rest, recharge, and spend some time with family. And I say that to the board, and I very definitely say that to our staff. Take that time, recharge, spend some time with your family. We appreciate everything that you do every day, and we're going to need you in the new year. So again, thank you, everyone, and we'll see you in 2022.
Happy holidays, everyone.
Sorry, one more quick thing I have to read.
Holidays.
Thank you. Before we close, I just want to remind any media who may be watching this meeting on YouTube live stream that we'll be having a Zoom media availability 15 minutes after adjournment. This replaces the post-media scrum that would normally happen after in-person meetings. If not already registered, media representatives wanting to participate can email ophmedia@ottawa.ca. And I just noticed that our next regular meeting is on Valentine's Day. So that's kind of fun too. So we'll see you all after the holidays, and enjoy the new year. Thanks very much.
Good evening, bonsoir. Je m'appelle Maxime Lee et je serai votre modérateur aujourd'hui. My name is Maxime Lee and I will be your moderator this evening. Thank you for joining us for today's media availability after the last Board of Health meeting of 2021. Merci d'être parmi nous pour ce point de presse à la suite de la dernière réunion du Conseil de la Santé de 2021. Before we begin, a few reminders, please. Please place your microphone on mute until I invite you to ask your question. Veuillez, s'il vous plaît, désactiver votre microphone jusqu'au moment de poser votre question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located in the top right corner of the Zoom video screen. Veuillez changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à droite de votre écran. On the call this evening, we have Board of Health Chair, Councillor Keith Egley. We have Dr. Vera Etches, Medical Officer of Health for Ottawa Public Health. The Director of Knowledge Exchange, Planning and Policy, Cameron Keys. And the Manager of OPH Performance and Corporate Services, Svetlana Valkova. And finally, the Incident Commander for the COVID-19 vaccine response, Sherry Beadle. Ici, durant cette soirée, pour vous, on a le président du Conseil de la Santé, le conseiller Keith Egley, la médecin en chef de santé publique à Santé publique Ottawa, Dr. Vera Etches, le directeur du partage des connaissances, planification et politique, Cameron Keys, la gestionnaire de la performance de SPO et des services corporatifs, Svetlana Valkova, et enfin, la gestionnaire des incidents pour la vaccination contre la COVID-19, Sherry Beadle. I'll now invite each media agency in alphabetical order by outlet to ask their questions. Please remember that you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique selon l'agence de nouvelles. Chacun pourra poser une question ainsi qu'une question de suivi. We will start with CBC Ottawa with Nicole Williams. Nicole, over to you.
Hi, thanks so much. My first question is for, I believe both questions will be for Dr. Vera Etches. I'm just wondering if you can confirm a few more details about these two new Omicron cases, as specifically where they traveled from, how they got here, and if they're connected to the two cases announced over the weekend.
Thank you. There are two more people, brings it to a total of 4 people who have tested positive for the Omicron variant. They are not related. They're all people who traveled independently and have been confirmed positive since their return. They're all isolating and following federal guidance. They all did come from Nigeria through to Ottawa. And so I think those are the main points in terms of local transmission. We have no evidence of that. And we are doing the follow-up with all of the high-risk contacts to also make sure that they know how to isolate or when to seek testing.
I know you cautioned against really travel from anywhere where a positive Omicron or Omicron's been detected. I'm wondering if you in any way expect, any restrictions, lockdowns, or maybe firmer guidance against traveling at this point.
Well, I think any international travel, you want to be as careful as you can because it is through exposure to other places that you may find the variant. And now, of course, you travel within Canada. You know that the basic measures of keeping distance, wearing a mask, keeping your hands clean, and staying home when you're sick are important. And being vaccinated is that foundation, that really we can see protects against severe illness. So, people need to travel for different reasons. That commentary about what's needed at the border is really federal policy. What I can do here in Ottawa is to remind people to travel as safely as possible if you need to travel. At this point, I don't see a need for additional public health measures in Ottawa. So What we have right now is a fairly stable level of COVID in our community. We watch it every day, and if there's a sign of any increasing rates of COVID that are rising quickly or something's different, we're looking for this variant, of course, with the sequencing being done through our partners at Public Health Ontario. We'll let people know if the picture is changing. But at this point, really thankful for what people in Ottawa are doing. They've held things steady through the Delta variant. And we need to continue to use those measures that we know make a difference to slow down COVID transmission.
Thank you very much. And thank you, Nicole. Next up is City News Toronto with James Mackin. James, over to you.
Hi, can everybody hear me?
Yeah.
Yeah.
Thank you. My first question is for Dr. Vera Etches. Is Ottawa Public Health investigating the possibility of any other potential cases in the region at this time?
No, we are not. Every person who tests positive for COVID-19, their lab test is used to screen for signs that this could be the Omicron variant, and we're not aware of any that are showing in the screening that this is a possibility. So at this point, this is all the results that we were waiting for around the confirmatory sequencing results.
Okay, and my follow-up also for Dr. Etches. At midnight tonight, the federal government will be getting rid of tests at the border for any fully vaccinated Canadians or permanent residents heading to the United States for 72 hours or less. With the new Omicron cases here in Ottawa and possibly some more in Hamilton, do you believe that there should be some changes to this policy, say more testing for people at the border?
I think that people need to be very cautious about their travel plans. If you're not vaccinated, it is going to be more likely that you'll be testing positive for COVID-19. So really, first of all, thinking about the travel plans and are they something that could be put off? In terms of testing, I think that it's a later level of defense after thinking about what activities needed after being vaccinated, using other layers of protection like wearing masks and keeping distance. These are important. But if people are experiencing symptoms of illness, that I would ask people to go to an assessment center for testing quickly. We had noticed a pattern where people are starting to delay their presentation to testing centers, 3, 4, 5 days after developing symptoms. And we just want to remind people, as soon as you feel something that could be COVID, that's the time to go and rule it out, or confirm it and then know that if you need to isolate and protect against the onward transmission.
Okay, thank you, Dr. Etches.
Thank you, James. Thank you, Dr. Vera Etches. Next up is CTV Ottawa with Ted Raymond. Ted, over to you.
Thank you. Good evening, everyone. My question is also for Dr. Etches. I was wondering if you could give us a little more information on these 15 other travelers that you say you're in contact with. Based on your previous responses, I'm assuming that they aren't suspected of having any COVID-19 and they're just isolating because they've returned recently. Can you describe a little bit about where they have recently been and just a bit more about what's required of them or other people who may be in their situation in the future?
Yes, so the federal government has notified us of people who've traveled from the countries where there is a greater concern that travelers could have encountered the Omicron variant. And so these 15 are the people that were identified for us. And they are required to isolate for 14 days and to, even if fully vaccinated, to make sure that they are seeking testing. And this would have happened right when they came back, a test immediately on arrival, but also 8 days afterwards. So we'll be checking in to make sure that those tests are done. At that point, we could see if there's a screening, indicator, this could be Omicron, but it will then go on for sequencing, and that result takes a little bit longer. During that period, of course, like anybody else, any returning traveler, if you develop symptoms after you return from traveling, to go get tested right away, and then isolate, and that we would try to make sure people are able to stay separated from the members of their household. So it means, can you stay in a separate room, decrease the exposure to others, or we're encouraging people, there are isolation centers. In Ottawa, we have an isolation center, it's voluntary, but it's support for people who can't isolate from others in their home.
Okay, understood. And I guess my follow-up question would just be, I understand that this is that everyone in the household is required to isolate and seek testing under these guidances. Do you have an idea of approximately how many people are in total are affected by these guidelines so far?
I know that there were 14 individuals, and I don't have the total number of household contacts, but that is something that our team, our case and contact management team would have.
Okay, thank you, and thank you, Ted.
Thank you.
Next up is Global News with Craig Lord. Craig, over to you.
Thank you. Dr. Etches, I'm just wondering, how long has Ottawa Public Health, with, as I understand it, help from the province, how long have we been sequencing for the Omicron variant? Has this been going on for a week or more or less? And is it possible that Omicron cases have come through Ottawa, but we just weren't sequencing for them yet, or we didn't know it at the time? Can you help break down those timelines for me?
Yes, we're very fortunate in Ontario that we have been since early November sequencing 100% of all of the samples from people who test positive for COVID-19. And so that means that if there was an Omicron variant from the beginning of November, that we would have indication of that, and it hadn't been detected so far in people testing positive. Again, you could check with Public Health Ontario, but my understanding is this is they've looked in detail at the sequencing that they have through the beginning of November, and then they've looked for that screening indicator that something isn't Delta, because 99.9% of samples right now are Delta, and they haven't seen that up until November 26th. And so now it's really a matter of active case finding as people come into the country, as people test positive. This is the process. It's actively looking for it, but it doesn't appear that there was nothing, no one who tested positive where the sequencing wasn't done this month, and so it doesn't look like there was any detection that could have missed because some sample wasn't sequenced. There is of course the possibility that people didn't get tested, but that this active work that we're doing now to look at the requirement now to be tested on immediately upon arrival and 8 days later, this will help us detect the Omicron and slow down transmission.
Thank you. And I know you just said that it's not necessarily the time yet for new public health measures or restrictions, but we're heading into the holiday season. What is your message for Ottawa residents, knowing that Omicron, a very unknown variant at this time, is in the city? How should they be conducting themselves, going to holiday parties, to workplace gatherings, that kind of thing, as we head into December?
Well, I feel like my message is actually the same as it was last week before we knew about Omicron, which is to do a risk assessment as you're thinking about the holiday plans, and choose the lower risk activities. So it starts with making sure you're vaccinated, that you have a booster dose if you're over 70 or in other population eligible for booster doses. It means choosing smaller sized gatherings, and looking at whether they can be outside or in well-ventilated areas, making sure masks are used indoors, and distancing helps. So it isn't quite, a normal holiday season yet. We're still in a pandemic. But of course, social gatherings are an important part of our life and our well-being. And we do have the protections of the vaccines, of these other measures that do slow down COVID-19 transmission. And so just encourage people to keep using the tools we know can work.
Thank you.
Thank you, and thank you, Craig. Nous allons maintenant passer au journal Le Droit avec Annie-Rose Deschâtelet. Annie-Rose, c'est à vous.
Oui, bonjour. Mes 2 questions vont être pour Mme Etches. Mme Etches, en fait, vous l'avez mentionné, là, Santé publique Ottawa fait le suivi étroit des contacts des cas du nouveau variant et s'est assuré que les cas sont isolés. Je voulais savoir s'il y avait quelque chose qui différait entre le suivi qui est fait avec un cas de COVID normal, là, entre gros guillemets, ou un cas, là, par exemple, du nouveau variant Omicron. Est-ce qu'il y a des mesures qui sont supplémentaires?
Oui, normalement, quand quelqu'un est vacciné, il n'y a pas une demande d'isoler après un voyage. Mais c'est différent maintenant avec les voyageurs de quelques pays où c'est un risque d'avoir le variant Omicron. Maintenant, si quelqu'un est vacciné ou non, c'est important d'être isolé pendant les 14 journées. Aussi, ça, c'est un peu plus long que si c'est un autre type de COVID-19. La période d'isolation, normalement, c'est 10 jours. Et pour cette situation, c'est 14 jours. Aussi, cette recommandation d'être isolé dans la maison, c'est normalement notre recommandation, mais c'est un peu difficile. Alors, on aussi offrir le centre d'isolation, c'est volontaire aussi.
Parfait, merci. Puis, en question de suivi, là, je voulais vous entendre en français sur le temps des fêtes. Évidemment, on est à moins d'un mois de Noël et la situation, ça évolue rapidement. Vous avez dit, évidemment, que la situation, c'est différent de l'an dernier parce que, justement, il y a plusieurs personnes, en fait, la majorité des gens sont vaccinés cette année. Mais est-ce que, malgré ça, ça pourrait être envisagé que des mesures restrictives là, soient mises en place pendant le temps des fêtes si on voit que la situation ne s'améliore vraiment pas puis que ça se détériore beaucoup?
Je pense que nous avons les outils de diminuer la transmission de la COVID-19. Et c'est clair maintenant, nous avons un système de surveillance de trouver cette variante si ça présente avec les personnes avec des symptômes de COVID-19. On peut déterminer si c'est Omicron ou non. Alors, c'est juste important de continuer les mesures de santé publique. Je n'ai pas envie de changer les mesures, mais juste de continuer avec caution.
Merci beaucoup.
Merci beaucoup. Maintenant, on va passer, we'll go to Ottawa Citizen with John Willing. John, over to you.
Thank you. Dr. Etches, I don't know if your staff do any surveys of people who come to get their vaccines, but in light of OC Transpo being free for a month starting in a couple of days, I'm wondering if you think that will help or convince families to bring their kids down to vaccine clinics or even to get tested at a testing site.
I think it's a great point to make, and I'll ask the team to advertise it a little bit more, that there's free transportation to our vaccine clinics on public transit. Transportation is something that we heard can be a barrier for some people. And it's why we've located vaccination hubs in 10 of the more disadvantaged communities where transportation can be more challenging. So we really want to offer people options. We're moving closer to where people live by going to 73 schools in Ottawa. So that also should help people who may not be able to take public transit with many children. I think this is also a challenge when it's a larger family. It can be harder to take everyone at the same time. So public transit is an option, and thank you for flagging that. We can help. The other thing that's close to home often for people is a pharmacy option. There are over 100 pharmacies in Ottawa offering the vaccine to children. So they're all listed on our website. It's really the Ottawa Public Health /child COVID vaccine is the place to go to find out what will work for a family.
Thanks, Doctor. I just got to pivot to flu vaccines for a second. And I know that many of the vaccines are being given out at pharmacies. And I know in the past, prior to the pandemic, OPH has run flu shot clinics. Do you think this is the administration method going forward from 2022 beyond, relying on pharmacies, GPs to be the primary vaccine administrators rather than operating flu vaccine clinics by the health unit?
Yes, I expect, actually, as has happened in the past, that the majority of influenza vaccine will be given by family physicians, nurse practitioners, and pharmacy locations. So it's something I'm very thankful for, this accessibility through pharmacies for flu and COVID vaccines. I think the pharmacies have a really important role to play coming up with booster doses. Right now, our clinics providing COVID vaccine are also immunizing young children, though. So the pharmacies don't immunize children under 2. And so Ottawa Public Health can help with some of the younger age groups not served. We see a role for public health in the flu campaigns to focus on populations that have barriers. So we still offer mobile clinics into congregate care settings, and we work with partners to support shelters. And so I think that's a kind of public health approach where we want to decrease the inequity in access, make sure everyone has access to flu vaccine. Our coverage rates have actually shown that has been effective in the past, where the coverage level for flu between the highest income and lowest income neighborhoods has actually been very similar in the past. So we'll keep working on the equity side, but the mass access, the pharmacies are just excellent because they are throughout most of our community. And so longer answer than you wanted. I've gone off into COVID again, but we're busy doing vaccination of children 5 to 11, people over 70, and so we only have so much capacity. We can't keep adding in access to new eligible populations. But as the pharmacies finish up their flu vaccine, they'll have that capacity to do more COVID. So I think this is something that we'll see how the system evolves, but I could imagine would be a longer standing point of access.
Thanks for that, Doctor. If I could just quickly, just to make sure that the 2 new cases of Omicron, those are not suspected, but they're confirmed at this point, correct?
We have in total 4 confirmed situations where an individual is tested positive for COVID-19, and it's been confirmed to be Omicron by sequencing of the variant.
Thanks for that, Doctor. I appreciate it.
Okay, thank you, John. Nous allons terminer avec Radio-Canada. Charles Lalonde. Charles, c'est à vous.
Oui, bonjour, merci. Docteur Etches, peut-être faire répéter un peu, vous l'avez déjà dit, mais pour les 2 nouveaux cas qu'on a parlé aujourd'hui, juste nous dire en français s'ils ont un lien avec les deux d'annoncer hier et autres informations pertinentes, s'il vous plaît.
Oui, hier, la province a annoncé 2 personnes le variant Omicron confirmé par dépistage et le séquençage. Aujourd'hui, il y a 2 autres et ils ne sont pas liés aux les premiers 2. Les 4 sont voyageurs qui viennent de Nigeria. et qui a voyagé indépendamment. Et il n'a pas une situation avec transmission locale. Ils sont des cas séparés.
OK, parfait. Merci. Puis aussi, j'avais une question pour, c'est pas pour vous, Madame, c'est pour Madame Valkova, oui. Vous avez présenté les grandes lignes du budget 2022. Si on veut, est-ce que vous pouvez nous faire un petit résumé, s'il vous plaît?
Svetlana, you can answer.
Je pense, mais en anglais, peut-être. Alors, juste, si vous pouvez répéter la question, je peux aider aussi.
Je suis plus à l'aise en anglais.
OK, parfait. On peut essayer. Oui, en fait, c'était, it was just to, can you just present about the budget, the headlines of what you present earlier, please?
Oui, et je peux aider aussi peut-être en français. C'est que le budget entier, c'est un budget équilibre de 123 millions de dollars. Une partie de ça, le 48 millions, c'est pas permanent, c'est juste une fois fourni par la province pour la réponse de la COVID-19, la pandémie. Il y a une petite portion de plus que vient de la ville. C'est pas trop petit, mais c'est important. C'est 1 million. C'est quelque chose qui aide avec la pression qui vient de les salaires et les contrats avec nos employés. On a confiance que la province va continuer avec leur soutien pour la réponse de la pandémie. Alors, c'est une grande réponse, mais aussi on a la possibilité de retourner et augmenter nos services pour les différents domaines de santé publique, d'aider avec l'utilisation de substances, de soutenir les familles avec nouveaux bébés. Il y a certaines cliniques comme les cliniques dentaires, de santé sexuelle, les cliniques pour la vaccination dans les écoles. On continue d'avoir plus d'optimisme que notre situation va améliorer et on peut retourner les ressources dans les programmes un peu plus normaux pour santé publique, mais c'est toujours la question d'un changement dans la situation dans la pandémie. Alors, nous avons discuté avec nos conseils que si la situation change, on a besoin de réexaminer les besoins, mais avec confiance que la province va continuer d'aider les réponses comme il y a besoin. Est-ce que c'est correct?
Oui, c'est parfait. Merci beaucoup. C'est très gentil.
Merci, Charles. Merci, Dr. Etches. So that is all the time we have for today. Thank you so much, everyone, for being our valued media partners and keep on keeping on. Donc, c'est tout le temps qu'on a aujourd'hui. Merci de votre soutien et bonne soirée. Good night, folks. Thank you.